Now we're going to talk about preventive health care, maintaining wellness. And as I mentioned before, the chiropractic profession has really pioneered the concept of preventive health care. There's an old saying, an ounce of prevention is worth a pound of cure. And that's so very true when it comes to our health. As a doctor in practice here in Staten Island, I always try to educate my patients, whether it's discussing things that they can do, whether it's giving handout sheets with guidelines on spinal care, whether it's discussing nutritional issues. It's important for a person to take personal responsibility for their health. And I feel always that if the doctor and the patient can work as a team, the best results will be achieved. Some patients are very excited and happy to take some responsibility for their health. Some do not want to. I feel it's my responsibility to make the patients aware of the issues in terms of maintaining their health. And it's up to the patient to decide exactly how much commitment they will have to maintaining their health. And most of the rules for maintaining wellness is not just for patients in a doctor's office, but for the general population. It's a matter of trying to stay well, staying healthy, and avoiding healthcare problems. Now, we look at health in three perspectives. We look at it from a chemical perspective, which is nutrition, and we look at it from a perspective of emotional, psychological state, which is dealing with stress, and we look at it from a mechanical perspective. And this, by nature of chiropractic, is the one that we concentrate mostly on. So we're going to address all three of these aspects of health maintenance. So let's look at the chemical perspective of health first. With chemical, we're talking about proper nutrition. A person cannot be at optimal health if they don't have proper nutrition. What you put into the body will affect how the body will function. And this is well known. And think of your body as a machine. Any machine needs certain fuels and certain spare parts in order to function. We get this through proper nutrition. So when it comes to maintaining wellness, proper nutrition is the first stage, and this is the chemical factor. Now, proper nutrition, there are two aspects of it. One is taking in the things that we need, and the other is not taking in things that are detrimental to us. So in terms of taking the things that we need proteins, we need carbohydrates, we need lipids or fats, and all in certain proportions. You don't want to take too much of any one of these factors. We need in certain proportions. We also need micronutrients like vitamins and minerals. And again, these are not things that can be done at random. It's a matter of different patients will have different particular needs in terms of the nutrients. In terms of protein, carbohydrates, and lipids, there are different perspectives, different opinions in exactly what the proportions should be. But the whole concept of moderation in all things, and not taking too much of any, keeping a well-balanced diet, and taking in things like the vitamins and minerals. You see, with the vitamins and minerals, these are micronutrients. We just need very, very small amounts in order to have real significant effect on our health. Now, theoretically, if we had an absolutely perfect diet, there would be no need to take supplements. Unfortunately, though, very often our diets are somewhat deficient. Very often our foods are too processed, and a lot of the nutrients are cooked out of them. And very often we're in situations between work and other activities where we skip meals. So I'm a big believer in taking supplementation for the micronutrients. This way you know you have them. And again, theoretically, if you had a perfect diet, it would be necessary. But the reality is that our diets are not perfect. So it's a good idea to take in the micronutrients and be careful with the macronutrients, with the proteins, carbohydrates, and fats in terms of keeping everything in the appropriate proportions. And there's a lot of individual variations. Some people have very particular nutritional needs. Some people have certain things like diabetes where they have to avoid carbohydrates. So it's a matter of, it's not just one size fits all. There are very particular needs. So taking in proper nutrition is very important. And as a doctor, very often patients are a little reluctant to eliminate certain foods from their diet. So the whole rule is moderation. It's like there's an old joke about the guy that goes to the doctor and says, "Doc, I've given up smoking, I've given up drinking, I've given up junk food, I've given up women. Will I live to be 100? And the doctor says, "No, but it'll sure seem like it." So it's a matter of looking at the reality of a patient's life and working within the patient's lifestyle and making modifications and remembering moderation in all things. So a person does need certain nutrients in order to be at optimal health. Now, the other aspect of health is not taking in the things that are detrimental to us. And very often we take in these things that we enjoy, and we know that they're not good for us. Most of us have too much sugar in our diets, too much fat in our diets. Very often things like candy that have minimal, if any, nutritional benefits. So it's a matter of being careful in terms of the amount of junk food that we take in. It'd be nice to eliminate all of it, but the reality is that if we're not willing to eliminate all of it, at least cut back on a lot of it. One of the really significant little behavior modification changes that can be made, this is a very common one. As a matter of fact, in my classes that I teach at the College of Staten Island, I asked the class, how many of you know people who salt their foods even before tasting it? And a lot of hands went up. A lot of people will put salt on their foods even without tasting and see if they need the salt. A little behavior modification tip. Before you salt food, before you put any salt on your food, taste it, see if you need the salt. Very often the foods are already salted, and very often you'll have a greater appreciation of the taste of the food if you don't put salt on it. But at least taste it, see if you need the salt. For some people, people with swelling in the extremities, people with blood pressure problems, they really have to avoid salt, a sodium-free diet. They really have to. But even if your diet is not one where you have to avoid salt, it's probably a good idea to cut back on the amount of salt you take. So a little behavior modification tip, if you taste the food before you put salt on it, that one difference can make a real change in your life. So it's a simple little change. If you need the salt, if you don't have a problem with salt, you can take the salt. But at least taste it first, see if you absolutely need the salt. That little behavior modification can make a big difference in the long run in your health and wellness. So it's a matter of watching the sugars, watching the candies and cakes that we take in, cutting back on those things, and taking in the nutrients that we need. And again, just like any machine, you need fuel, you need spare parts. We get that through proper nutrition. And the proper nutrition means taking in the things that we need and avoiding the things that are detrimental. So that's a chemical aspect of health. Now the next aspect is a psychological or emotional aspect. If a person is in an unstable emotional state, he or she cannot be at optimal health. Anything that happens in the mind will have some kind of manifestation in the body. And very often this is something that's not taken seriously enough by healthcare professionals. It's important that you work with a patient in terms of being in a stable emotional state. Sometimes a patient needs to go to a mental health professional, psychologist, psychotherapist, psychiatrist. Sometimes that intervention is necessary. Sometimes there are just little things a person can do to learn to deal with stress effectively. Stress is part of life. We can't avoid it. As a matter of fact, we need stress. Stress is what motivates us to accomplish new things. So stress is part of life. But the key is how we deal with stress. We have to learn to deal with stress effectively. So, for example, let's say you have two school kids. They have a big exam the next day, and neither of them has studied for it. If one student says, oh no, I'm going to fail, I'm going to fail, I'm going to fail, and spends that night pacing back and forth saying they're going to fail, they're probably going to fail. If the other student decides, you know what, I'm going to do what has to be done. I'm going to stay up all night, I'm going to study, I'll go to sleep afterwards, I'll crash out afterwards, but I'm going to do the studying needed because I know I've got to pass this course. That person has a pretty good chance of passing the course. So here you have two people, the exact same situation, the exact same stress, but they're reading it differently. They're responding to it differently. One is being motivated by the stress. The other is falling apart as a result of the stress. So the key is to learn to deal with stress effectively. Now, there are certain stresses that we purposely subject ourselves to. Sometimes we watch movies, scary movies, where there's stress. The movies where murder mysteries, or movies like Jaws, where you see someone's head floating by and we're shocked by it. This is stress, but we are seeing it as entertainment, and we enjoy it. So we deal with the stress effectively. We process it effectively. So we have to learn to deal with stress in a positive way. So there are things that we can do, things like meditation, things like looking at the stressful situation and looking at it and evaluating it and seeing what the possible results are and realizing that these things are not the end of the world. Sometimes we're overwhelmed with stress and we need professional intervention. Sometimes a medical intervention is necessary. But very often we can develop the tools to deal with stress effectively. Sometimes it means going out for a walk, doing some exercise. Exercise can be a great stress reliever. So it's a matter of learning to develop the tools to deal with stress effectively. So look at the stress, reevaluate the stress, learn to deal with it effectively. Stress is part of life. We cannot avoid it. Very often people have stressful jobs, but you know what? You need your job. If you can change jobs, great. If you can't, you have to learn how to deal with it effectively in terms of learning to laugh at things, learning not to get emotional about things, not holding it in, but letting it slide off your back. So the key is not that you can avoid all the stress in your life, but learning to deal with it effectively. And again, whether you use meditation, exercise, neuro-linguistic programming, any technique that you can use to deal with stress effectively, that's great. So you let it slide off your back rather than holding it in or having a very bad reaction to it. So stress is part of life. The key is to learn to deal with it effectively. And sometimes we can do it on our own. Sometimes we need a health care professional to intervene. But the key is we have to learn to deal with stress effectively. And if we can't deal with stress effectively, we cannot be at optimal health. That's a psychological or emotional factor of maintaining wellness, learning to deal with stress effectively. Now, the third factor is the mechanical or structural factor. There's a relationship between structure and function in the body, between the anatomy and physiology of the body. Anatomy is a structure, physiology is a function. And there's a relationship there. Things that will affect the structure of the body will affect the function of the body. And as a chiropractor, that's the main thing that we look at. We look at the spine as a way of addressing problems in the body. We have a plastic spine over here, and we look at the spine, and what the spine is, it's a switchboard for the entire body. We have the brain, and we have the spinal cord, which is just an extension of the brain. The brain, of course, is protected by the skull. The spinal cord is protected by these bones, which are called vertebrae. And so the vertebrae serve as protection for the spinal cord. So the spine becomes a switchboard for the entire body. The way the messages get from the brain to the various parts of the body, from the parts of the body back to the brain, is by going through the spine. The spine is a switchboard for the entire body. So if anything interferes with the spine, it will interfere with this nerve flow throughout the body. Now, what happens very often, these vertebrae go in and out of place. That's what gives us movement. The vertebrae go in and out of place. That's what lets us bend in different directions. Sometimes the vertebrae get fixated out of place. When they get fixated, they put pressure on the spinal nerves. In chiropractic, we call this a vertebral subluxation. The more common term is a pinched nerve. So if there's a pinched nerve in a particular area of the spine, that whatever part of the body is supplied by that nerve will also be affected. So if there's a pinched nerve at the neck, that can cause pain and stiffness in the neck. It will also cause numbness and tingling radiating through the arm. If there's a pinched nerve in the low back, that can cause sciatic pain, which is pain radiating through the thigh and leg. So whatever part of the body is affected by the pinched nerve, there will be symptoms of that part of the body. So it's important to maintain wellness of the spine. Now what the doctor of chiropractic will do is locate vertebrae that are out of place, putting pressure on the spinal nerves. And the doctor of chiropractic will locate these vertebrae and manually adjust the vertebrae back into place to correct the subluxation, to relieve the nerve pressure, and allow the body to restore itself to optimal health. Now, most people that go to see a chiropractor, they have neck pain, back pain, stiffness, sciatica, headaches. They already have these symptoms, and they go to the doctor of chiropractic, and the doctor of chiropractic will locate the cause of the problem and make the correction. And the main thing the doctor of chiropractic will do is a chiropractic adjustment, which is the way he or she will correct the subluxations and allow the body to restore itself to health. In addition to that, some chiropractors like myself will use adjunctive therapy, things like electrical stimulation, heat, electroacupuncture, and also nutritional advice. We use other things in addition to the chiropractic adjustment. But the main thing that we do is the chiropractic adjustment. That's where the doctor of chiropractic has specialized training in locating these vertebral subluxations and correcting them to relieve the nerve pressure, to allow the body to restore itself to optimal health. Now, the traditional chiropractic adjustments are done by hand, where we manipulate the spine by hand. There are also non-force adjustments. We use various types of instruments that use no force. So even people with brittle bones, like with osteoporosis, or people that are squeamish about the cracking and popping sound, can get chiropractic care. They don't have to compromise their care because there are non-force techniques that are available today. Now, there are things that a person can do to maintain the wellness of their spines. The people should learn to do things like sitting correctly, standing correctly, sleeping correctly. So let's talk about that now. A person should get in the habit of standing up straight. When you're standing, stand up straight. Some people tend to slouch, and that will tend to cause more spinal problems. So it's important for a person to get in the habit of standing straight and walking straight. A good way of practicing that is standing up against the wall. Put your head, your back, your buttocks, and your heels touching the wall. Tighten up the abdominal muscles and the buttock muscles and walk away from the wall holding that position. It may feel a little strange at first, but as you practice, it'll become second nature. So it's good practice in terms of learning to walk straight. Now, if you're standing in one place for an extended period of time, there's a good thing to do, not to cause your knees to lock. So a good idea is to keep one knee a little bit bent at all times, and you'll be relieving the nerve pressure on the low back. So if you're staying in one place for a long time, keep one leg straight, bend one knee, and after a few minutes, switch to the other side. If you're able to, if you can put one foot up on a small box and to help keep it bent, that would be good. And every few minutes, shift to the other side. So if you're standing in one place, that's a good way of avoiding spinal problems by keeping one knee a little bit bent. Now, if you're sitting, it's important to sit up straight, not to slouch. You should use a seat with a good back support, and avoid sitting for extended periods of time. And when you get up, you can brace yourself when you get up so you're not straining the back when you get up. A lot of people spend a lot of time sitting in front of the computer and develop some serious back problems as a result of that. So it's important to sit up straight. When you lie down to go to sleep, you should sleep on your side or on your back. Never sleep face down. That causes problems with the neck and problems with the low back. So you should sleep straight, lying straight. And a good firm mattress is a good idea also. There's some controversy over the firmness of the mattress. You want to have a mattress that you can sleep comfortably on, but as firm as you can tolerate is probably a good idea. And when you sleep, you shouldn't have 2 or 3 pillows propping up your head. The best thing is a cervical pillow, where the main part of the pillow is underneath the neck, not the head, to support the cervical curve. There are curves that are normally found in the spine that are important for maintaining wellness. These curves that are found in the spine, when you look at it from the side, are healthy. That's normal. We're not talking about a scoliosis with curves to the side. We're talking about curves to the front and back, which are important for maintaining the wellness of your spine. So if a person will sit straight, sleep straight, walk straight, that can help them to avoid spinal problems. And it's a good idea to have your spine checked out on a regular basis by a doctor of chiropractic. Everybody knows when you have neck pain or back pain, sciatica, headaches, everyone knows that these things respond very well to chiropractic care. But it's important to not wait till there's a problem. Have your spine checked out regularly by a doctor of chiropractic, not wait for the problems. So it's a good idea for all of us to practice healthy practices and hopefully avoid health problems. So hopefully you've benefited from today's discussion, and we'll tune in again and on Back to Health. So I want to thank all of you for joining us on Back to Health. We'll see you again real soon. In the meantime, please stay healthy.